Hi, my name is Mohamed Abdulla. I'm a chest physician and lead lung cancer clinician here at Chesterfield Hospital. When it comes to lung cancer outcomes, we don't perform as well as the rest of the developed European counterparts. There are several reasons for this. One of the reasons is the long delay in the diagnosis from the time the patient presents to the primary care doctor with symptoms of possible lung cancer. With the current practice, one of the big delays that occurs is the time it takes from chest X-ray to CT scan. Our local data suggests it can take anything between 3 to 14 days and sometimes more from chest X-ray to CT scan. CT scan following the chest X-ray is the first key diagnostic investigation, and reducing the time to CT scan is crucial in getting the diagnosis early. In the last 2 years here at the Chesterfield Royal, we have been working very hard to improve and streamline the lung cancer pathway to reduce these delays during the diagnostic stage and support our patients through this very stressful journey. We have introduced many changes to the way we work and have introduced new services to facilitate this. We are now delighted to introduce the concept of straight CT. With the introduction of straight CT concept, we hope to reduce the time it takes from chest X-ray to CT scan to a maximum of 3 days. With this new way of working, if a GP refers a patient for chest X-ray with suspicion of lung cancer, that chest X-ray will be reviewed on the same day by a trained radiographer or a radiologist. And if a CT scan is required, our radiology department will contact the patient with an appointment for the CT scan. We are hopeful for most of those patients who need a CT scan, this will happen the same day and no later than 3 days. The radiology department will also inform lung cancer team about the patient, and the lung cancer team will arrange an appointment within 7 days of the CT scan.
Hello, my name is Lisa Serevena. I'm the CT and MRI lead at Chesterfield Royal. Your CT scan will be quick. The scanner uses X-rays, the same as a chest X-ray, but takes multiple slices, which gives detailed information to the radiologists who report the scan. It normally involves a contrast dye or injection to give the radiologists extra information and detail of the organs, blood vessels and any potential abnormalities. The scanner is described as a polo mint, which you will pass through. You will need to follow the instructions the machine provides, which will ask you to breathe in and hold your breath. After the planning scan, you will be given an injection of dye using the injector. The radiographers will monitor you throughout the scan in the control room to make sure you're okay. When you arrive in the CT department, the radiographers and the imaging assistants will go through a checklist to ensure you're safe to proceed with the injection and the scan. If you have any of the following risk factors, such as kidney problems or are over 65, diabetic, we will use any recent blood results, or we will test your blood using a special machine that's on site to minimise delays. You will also be asked if you've ever had an allergic reaction to iodine contrast. If you have any issues with blood access, allergies, mobility needs, please flag this up when your appointment is being booked so we can give you the resources and the time you may need. Once happy, you'll be guided through the scan by the CT team. The scan itself takes less than a couple of minutes, but we will keep an eye on you for half an hour past your injection time. This is just to make sure you're okay before you leave. There are no instant reports due to the detail of the scan, but we will report as soon as possible with the results waiting for you for your follow-up appointment.
I'm Jill Alsop, the lead lung cancer specialist nurse. Following attendance for the chest X-ray and CT scan, you will be offered a 2-week wait appointment to see a respiratory consultant. Also present at this appointment will be a member of the lung cancer clinical nurse specialist team. This team becomes the patient's key worker and point of contact throughout diagnostic tests, treatment and ongoing supportive care. During your consultation, you will be informed of the CT scan results and the next steps to gain a diagnosis. For some patients, this may be a short process. However, for others, it may be longer due to the complexities that may occur. This may include location of tumour, current health and well-being, or further tests to aid treatment plans.
Hello, my name is Roxanne Pelusi, lung cancer CNS. Awaiting results can be a difficult and anxious time. We encourage patients to contact us with any worries, questions or concerns. As a team, we also work in the background coordinating the investigations to ensure a prompt diagnosis.
My name's Laura, I'm a Macmillan Lung Cancer Assistant Practitioner. All results of the tests will then be discussed with the specialist team, which includes the respiratory consultant, consultant radiologist, consultant histopathologist, thoracic surgeon and an oncologist. The patient will then be contacted as soon as possible with a further appointment to come and be given the results in a structured care plan.
We are passionate about improving our lung pathway to avoid any delays in getting the diagnosis, so our patients get the maximum chance of having a curative treatment. But also for those patients who don't have cancer, it is vitally important we provide them that reassurance, and I hope these changes we have introduced will go a long way in achieving that.